Understanding HHT. Hereditary Haemorrhagic Telangiectasia, or HHT, is a relatively rare condition that affects blood vessels throughout the body. Hereditary means that it is passed down in families. Hemorrhagic refers to bleeding due to fragile blood vessels. And telangiectasia is the term for tiny abnormal blood vessels near the surface of the skin or inside the body. HHT affects around 1 in 6,000 people worldwide. That's roughly 11,000 people in the UK and over 55,000 in the US. However, the condition is significantly underdiagnosed. In the United States, it's estimated that 90% of people with HHT remain undiagnosed. HHT is a genetic disorder inherited in an autosomal dominant pattern. This means if one parent has HHT, each of their children has a 50% chance of inheriting it. HHT occurs across all demographics, with no bias towards sex or ethnicity. Frequent nosebleeds are a common early sign of HHT, and some people may also experience recurring headaches. Small red dots, called telangiectasia, can appear on the lips, nose, ears, and hands. Not all signs of HHT are visible. Inside the body, abnormal blood vessels known as AVMs can develop in organs including the lungs, brain, and liver. AVM stands for Arteriovenous malformation. In a healthy blood vessel system, arteries carry blood into a fine network of capillaries where oxygen exchange takes place. In an AVM, this capillary network is missing. Blood flows directly from arteries to veins, creating high-pressure, fragile connections that are prone to rupture. These internal AVMs carry serious risks. AVMs in the lungs can allow clots or bacteria to bypass the body's filters, leading to strokes, brain abscesses, or sudden bleeding into the lungs. Brain AVMs may cause seizures or life-threatening hemorrhages if they rupture. Liver AVMs can strain the heart by creating extra blood flow, sometimes leading to high-output heart failure or complications with blood pressure. While the complications of HHT can be serious, there are effective treatments available. Pulmonary AVMs, that's AVMs in the lungs, are often treated with a procedure called embolization. A thin tube is guided through the blood vessels to the AVM, where a tiny coil or plug is placed inside the abnormal vessel to block it safely. Treatment for AVMs in the brain needs to be highly precise. One option is stereotactic radiosurgery, a non-invasive technique that uses tightly focused radiation beams. A powerful dose is delivered to the AVM while sparing healthy brain tissue. Over time, the abnormal vessels shrink and close off, reducing the risk of bleeding or stroke. AVMs can develop without any symptoms, so early screening and diagnosis are vital, especially for those with family history of HHT. Doctors may use MRI, CT scans, or echocardiograms to check for AVMs in the lungs, brain, or liver. To help confirm a diagnosis, doctors use what's known as the Curaçao criteria, a clinical checklist based on symptoms and family history. If 3 or more criteria are present, a diagnosis is likely. Genetic testing can confirm the diagnosis and identify relatives who may have inherited the same altered gene. Visit curehht.org for more information and support. If you or a loved one shows signs of HHT, speak to your doctor about screening or genetic testing. With early diagnosis and the right care, people with HHT can stay well and thrive.